Hi there. We're going to go ahead and do some demonstration for phlebotomy now. I have all of my supplies here. Let's go ahead and take a look at what we have. We have a needle. I'm going to show you two different methods here. So we have a needle and a hub for the vacutainer method. We have a butterfly needle and a syringe for the butterfly syringe method. And we also have a hub to go along with the butterfly for that method. And then a couple of tubes, some alcohol prep pads, gauze, and of course our PPE, our gloves, okay? All right, so first, what I want to go ahead and take a look at here is how we assemble everything. Okay, so we would first, of course, wash our hands and apply our gloves. You always want to make sure you have gloves on as you're starting to assemble things because, you know, as far as the needle and whatnot, they are all sterile in their packaging, okay? Now, if you've watched my video about phlebotomy, the theory of phlebotomy, I did show you a picture of one of these needles and pointed out that the clear or white end is the end where the rubber-covered needle is that goes into the hub, which eventually will penetrate the tube. And then the color end, which in this case is green because these are 21 gauge. Black is 22 gauge. There's various colors. That's where the bare exposed needle that we will be using to actually perform the venipuncture is. So if you go ahead and you try to take off this end in this manner by holding each end, I'm not going to do it because I don't want to stick myself. Inevitably, this end always comes off first, and then you have a bare needle that you have to try to put the cap back on. So instead of pulling like this, hold the center where the safety device is and pull the end off that way, because then the end with the bare needle will not come off. Now, like I said, don't let this fool you. This is a needle underneath this piece of rubber. So don't, accidentally stick yourself with it. But this will get screwed on to our hub. Now keep in mind, you want it to be on there firmly and so that it doesn't come off. However, you don't want to tighten it so much that it breaks the plastic because everything's plastic here, okay? Except for the needle, which is metal. Okay, so that is assembled, that is ready to go, and that is all we need in order to draw with this method, okay? So I'm just gonna lay that down. Let's take a look then at our butterfly. So our butterfly comes in a package like this. Let's go ahead and open it, maybe. This has always been my biggest issue in the medical field is opening packages. You will have yours too if you don't already. You know what? We're just going to do this. Okay. So your butterfly has, get this out of the way. This is the end with the needle. Okay. And this yellow piece here is the safety device. They're all a little different. This one actually slides. Some do have a safety that flips up kind of like this one, but they're all going to be a little different. Some have a little button that you push that actually retracts the needle. But here's your needle in here. Here are your wings. Let me fix my gloves here just a bit. There we go. Your tubing, and then this is the end that attaches to whatever device you're going to use for the method you're using. So there's two different things you can do here. You can actually go ahead, pull this part off, and screw it onto a hub and then just pop your needles off and on, which I'll show you here in a minute. Or you can remove this piece completely, leaving only this, okay? And that can then screw onto a syringe if you're going to be doing that. Now, as I talked about in my other video on theory of all of this, syringes are better to use if you're pulling from, say, the back of the hand, or very, very fragile veins on maybe like children or the elderly, because then you can control the rate at which you are pulling that blood, and the veins are less likely to collapse. If you're drawing from an arm or something like that, then you can go ahead and have this on and put this on and use your vacutainer tubes, okay? For today, to demonstrate, because I am going to demonstrate the vacutainer method and the butterfly, we're going to go ahead and just attach the syringe to the butterfly. So this would go ahead. I always like to prime my syringes, meaning just kind of pulling them back and forth a couple times, because in the package and brand new, that rubber in there, that rubber stopper, has a tendency to stick to the inside. And I don't want to be, I'm only gonna have one hand to use this when the time comes, and I don't want to have to be fighting with it. So that just screws onto there, okay? And just, like I said, just make sure it's on there good, okay? And we will put that aside. Now, this is my, for all intents and purposes, my patient, okay? We do have a little bit of pretend blood, and I'm hoping that this will work well. However, you'll probably either watch after this, or you have already watched. I did a very short video about how to tie tourniquets. So hopefully you watched that and you've got your tourniquet tied. You have felt for your veins. Okay, and you're hoping that I'm hoping that the fluid is actually in these veins. Okay, there we go. That's a good one right there. Once you have found that vein, you're going to go ahead and use an alcohol prep pad to clean that area. Now, when you clean the area, you want to make nice big circles. Don't just do this or wipe like this. Take it, put it in the center of where you're going to go, and then make nice big circles. That way you're pushing the microorganisms away, and therefore helping to get those out of the way. All right, so I'm going to go ahead and take my my tubes that I have here. I am right-handed, so I want to, for this method, I want to put my tubes on the left side, because it will be my left hand that I will be using to do the tube. You put the tubes in and out, and it'll be my right hand that I will be using to actually puncture the skin. All right, so now I have this. I want to go ahead and pull my safety back, and here's why. If I leave it up like that, I take the cap off, and then I go to pull, see how close my finger is to where the needle is. I could accidentally stick myself. I don't want to do that. So on any needle that has a safety like this, you always want to pull it back first. Not to mention, it's very helpful, especially for people that don't have the greatest eyesight like myself. You want the bevel on your needle, the opening of your needle, to be facing upwards. And if you have the safety back and you have the safety on top, the safety is on the same side as the bevel of the needle, so you don't have to look and try to find it. Okay? All right, so we have our needle on, we have cleaned our area, we have our tubes ready. Now we're going to go ahead and uncap our needle. And if you've seen any of my other videos where we're dealing with needles, I always say to uncap this way. I call it chicken wing. Because if you uncap like this, you could very possibly stick yourself. Uncap this way is much safer. Okay, so we uncap, we have our needle now, and put that off to the side. we are going to want to anchor our vein. Okay, and like I said, that's pulling down on the skin. And then we're going to go in just a quick motion, just like that. Grab our first tube, and we'll go ahead and stick that on. It's coming kind of slowly because there's no heart here. And it's a little amount, okay? We'll push that over there. And I do want to show you something very quickly. And this, please do not look at how I have my needle here. These areas here are called flanges, these little pieces that stick out. And no, you wouldn't leave a needle in somebody's arm like this. Please do use those flanges when you're pushing your tube on and taking it off. And notice that I'm just going to move my hand away. You would not let go like this, but I'm going to move my hand away so you can see. Notice that I'm using my fingers on the flange and my thumb on the tube to pop that tube on because I'm pushing and pulling at the same time. Okay. Versus, let me go ahead and take it off real quick, versus just pushing like this, because if you watch very closely to the needle, when I just push like this without using the flanges, look what happens. That needle gets pushed in further, and that could cause you to go through the vein. Not only that, but also to, you know what, I need to leave that open. Okay. Also to cause you to come out of the vein and not get your blood. So please always push and pull at the same time, because then, if you notice, my needle doesn't move. Same theory when you are taking the needle off, okay? You want to go ahead, and I use the back of my finger. You can do whatever's comfortable for you. But now you're going to push against the flange while you're pulling the tube off, because then the needle doesn't move, versus just pulling the needle off, then you could end up taking your needle out, okay? So that is something that you really want to pay attention to. Now, I'm sorry that I pulled my needle out. Let's go ahead and put that guy back in there, and we'll put our last tube back on just to go from here, okay? So once you take that last tube out, you want to go ahead and pull your tourniquet off, get your 2x2 gauze ready, and then pull your needle out and put pressure. Now, please do not, try to avoid putting this down on the needle before you pull it out. I see people that do that, and a couple things can happen there. You could stick yourself as the needle comes out, and you're pushing the needle into your patient's arm, which is not good at all. So just get it ready, remove your needle, and put pressure, okay? Then at the same time, while you're holding pressure, or you can even ask your patient to hold pressure for you, go ahead and safety your needle. Now, these are made to be safetied with the thumb. However, I don't feel comfortable doing that. I prefer to use the rigid edge of the table to just go ahead and push down and safety. And then you would go ahead and dispose of this, okay? Once you have sufficiently stopped the bleeding, or at least slowed it, then you can take your 2x2, go ahead, fold it into a little square, and there you can either tape it or use Coban to keep it in place. Okay? All right, so that is that. I'm going to go ahead and dispose of all of this. Okay, now let's go ahead and take a look at our butterfly. Okay, the butterfly is used a little differently in that we don't have the tubes going off and on unless you're using that method, in which case you would do it just like we just did. And the hub would be attached here. 9 times out of 10, you're going to use a syringe with a butterfly. So again, make sure that is on the side of your non-dominant hand. Okay. We would find our vein again, which this one I believe is right here. After we've tourniqueted the patient, of course, we would go ahead and clean the area, nice big circles. And then if you take a look at this butterfly, you'll see, and I hope you can see, one side just has these little kind of indentations on the edges. The other side actually has like gripping bumps, okay? The side without the gripping bumps are the ones that you want to have up. That means your bevel is up. That means everything is up, okay? Now, some people, I've seen people hold it like this, which is fine. I've seen people hold it by one wing. Again, if you're comfortable, I don't do any of that. I prefer to actually fold the wings together and hold that way. It gives me more control. It gives me a better feeling of, knowing where I'm going with my needle. Okay, so once you have it ready to go, you're going to go ahead and uncap the needle. Again, chicken wing. Have this ready to pull on the side. Anchor. We go in, and then we would just pull slowly, and as you can see, our blood is coming into our syringe. Now, you don't want to get air in there because that will replace where you need to have your blood. And you won't be able to get as much blood in. So, as you're pulling, if you start to see some air, just stop for a moment and let it fill. Okay, notice that. This is, of course, not a human being that I'm drawing on. Their blood is being pumped through with a heart, although venous blood's returning, but there's still some force there, which would allow that to fill up. This guy's, has no heart. So we go ahead and we just keep going. Okay. And then once we have a sufficient amount of blood, we're going to go ahead and just lay that down, grab our 2x2, go ahead, remove, and pressure. Okay, now blood it's a commodity, right? So we don't want to waste any. So what I do at this point is go ahead and just pull the rest of that blood out of that tubing. Okay, sit that down. This is where the safety comes in. You hold the safety, you hold the yellow part at the bottom here. Let me kind of do it this way so you can see a little bit better. And then just literally take the tubing and pull. And it will cover that needle up for you. Okay. At this point, you could, it's not best practice, but if you don't have a transfer device, which I do not, you could take this off, this apparatus here, and put it directly into the sharps. You'd either put on a transfer device, which basically looks like a hub, like one of these, with a, basically with this in it, okay? In fact, I'm kind of curious if I can do that. Make my own transfer. No, it's not big enough, but... and then that screws onto here, and then you just put the tubes off and on here to get the blood. Otherwise, and again, not best practice, but if worse comes to worse and you don't have a transfer device, you can take this apparatus off, put just a regular needle on here, and then just take your tube and stick it right into the, or the needle into the tube, and it will pull the blood for you, okay? But other than that, that is my demonstration for today. Thank you so much for joining me, and I will see you next time. Take care.